would like to invite Dr. Sarmad Maqbool, who is the Director of Marketing Strategy of Abbott, who has supported us and helped us to organize this conference. He will be speaking on the role of pharmaceuticals in completing the quality loop. And I would request to please keep your presentation in the 10 minutes so that we can complete this program at time.
Bismillah ar-Rahman ar-Rahim. Professor Masood Hamid Khan Sahab, my favorite teacher and my very good friend, distinguished audience, ladies and gentlemen. First of all, aap sabko Yawm Pakistan Mubarak ho. Pakistan Day is the biggest thing today, and I think it's only appropriate that we should start with the Pakistan Day. Thank you so much. I was asked to talk about the role of pharmaceuticals in completing the quality loop. And very interestingly, if I may say that if somebody from the audience is thinking that I'm going to talk about quality assurance and quality control, I think you will be sadly mistaken. I'm not going to talk about the quality control at all. I'm going to talk about something which is very dear to my heart and which is the future of the pharmaceutical industry in catering to the needs of the patient. And that is what I'm going to talk about. And I'm going to tell you that the quality loop, which Dr. Murad very rightly said, actually begins and starts from the patient. And all the healthcare professionals are geared towards working to that particular thing. Can I have the next slide, please? Next slide. Okay, just a little request. Please kindly mute yourself so that there is no disturbance. Next slide, please. Now, making predictions about the future is a very tough job. Professor Dr. Lord Kelvin, President of the Royal Society, in the last century actually made 3 very big predictions for the future, and all of them actually don't hold true. Radio has no future, he said. And he also said that heavier than air flying machines are impossible to make, and X-rays will prove to be a hoax. When I started my career way back about 25 years ago in a cell company, which had just come in, mobile company, we made a survey and we said that cell phones will be used only in places where there is no PTCL line. And you can imagine how wrong we were. So actually talking about the prediction, can I have the next slide, please? Looking into the future, we make common mistakes, and some of these are that we make predictions rather than attaching possibilities and probabilities to the possibilities. We simply try to extrapolate what we are seeing today, and we only see one future coming up. We don't try to create scenarios for the future, and that is where we go wrong most of the time. Next slide, please. Now, the CEO of Coca-Cola said that if you think that you can run an organization in the next 10 years as you have run the organization in the past 10 years, you're surely out of your mind. Next, please. Bernard Shaw said another very interesting thing. The future belongs to the unreasonable ones, the ones who look forward, not backward, who are certain only of uncertainty, and who have the ability and the confidence to think completely differently. And that is what is going to shape the things of things come. The point is that we do not need to predict the future, but we need to get ready to sharpen up our skills to meet the future and embrace the future upfront. Now, foresight is the method of thinking about the future in order to think what should be done now. Next slide, please. So what are the expectations from the pharma industry today? Obviously, you expect quality drugs. I won't talk about that because in a good pharma industry, the quality is always built in. It is not just one process, it is a chain of processes which actually makes a quality product. Research and development is something else that you require from the pharma industry. Updated information about the products, cost effectiveness, that's very important. Contribution to disease awareness, this is also important, and support and participation in educational activities is also considered to be part of the health industry, the pharma industry as such. Next, please. However, let's look at the foresight. What is going to happen? We have to develop a healthcare system in Pakistan, which unfortunately today is in a fragmented condition. We have an aging population. People are going to get older with time because of the improved facilities that we are getting. We have both public and patients who are supposed to be catered to. There is a lot of international influence on health and healthcare. People know a lot about it. Pharmaceuticals, biotechnology, and medical devices are really changing, and you're getting some really drugs which can actually change the course of the disease. Organizations and delivery of healthcare is a very important thing that we need to look into. And of course, the age of information is here, and we need to talk about information in great depth. Next, please. So what are the drivers of change as far as our country is concerned? I'm trying to just take you to the future, because what is happening today is going to turn into the future tomorrow, and of course we're going to be, if you're not ready today, we won't be able to meet the challenges of tomorrow. Internet is becoming a very big reality. Even in the smallest towns of Pakistan, you can see that internet is surfacing very quickly. This is the beginning of the information age. There's a lot of globalization. People in Pakistan are traveling out and in like anything today. Cost containment, of course, is going to be and will remain a major challenge. Aging of the society will again become a very important channel. Managerialism, as Dr. Murad very rightly pointed out, managerialism is creeping into every aspect. Everything has to be managed as a business, and that is what is happening. And let's not close our eyes to that. While sticking to the very strong ethical things, we need to make sure that what is happening tomorrow, what is going to happen tomorrow, we should be ready to embrace it today. Can I have the next slide, please? Now, another driver of change is that the patient is also becoming different. There is a rise of the sophisticated consumer, as we say. This is becoming very fast a 24/7 society. All the time of the day, every time the business is going on. Science and technology is becoming part and parcel. There's a lot of biology coming in and a lot of IT coming into medicine also. So these are the things that have to be embraced very quickly. Ethical issues are supposed to be on the forefront. I fully agree that unless and until we have the ethical issues, the quality cannot be sustained or even maintained. Changing boundaries between health and healthcare, and of course there is a very strong changing environment. Next slide, please. So who are the stakeholders? Next. We know very well that the major stakeholders are the healthcare providers, professionals, and that includes all people who are related to the healthcare industry, regulatory authorities, pharmaceutical industry, public and private hospitals, and ancillary service, the labs and all this. These are all the major stakeholders in the healthcare system which needs to be developed in Pakistan. But please remember, next slide please, the center of everything is the patient. Always remember that whatever we do, whatever profession we are in, whatever segment of the health industry we are in, our focus of attention has to and will always remain the patient. And that is because we are all working towards making the life of the patient better and taking the humanity out of misery. Next slide, please. So what is the problem that we have? The problem is that we today have a system which is designed for episodic care only, when most of the disease is now getting chronic, and we know that. Healthcare providers are operating in silos. Everybody is doing a great job, but it is not coordinated. It is fragmented. A system full of underuse, inappropriate use, and overuse of care is there. A fragmented system characterized by unnecessary duplication, long waits, and delays is causing a lot of wastage of the useful resources. Poor information systems, disorganized knowledge, again is contributing to the slow development in our part of the world. So if we want to have a future healthcare system in which we can look into all these things, we need to address these problems one by one, and we need to address these very quickly so that tomorrow our children can have a better future, they can live in a better Pakistan than what we are living today. Next please. Now, we must always understand that gone are the days when medicine used to be very simple and the job of the pharmaceutical rep used to be very simple. You know, when I started my career 23, 24 years ago, it was the pharmaceutical representative who was well trained. He would go and visit the doctor, talk to him about something, give him the product information, the doctor would prescribe the medicine, and that was the end of the story. Everybody was happy, the doctor was getting good patients, the medical representative was getting good salary and bonuses, and that was the end of the story, and the patient was also having some medicines, and that's about it. But today, the world is changing very quickly. Next please. Today is the age of internet. Today, the doctor, the medical rep, and the patient all have access to a lot of information, a lot of data through the net. They can actually come and talk very differently today. Professor Masood Hamid Khan would agree with me that 25 years ago, the patients used to be very simple patients. Today, the patients are coming with a lot of knowledge, which is excellent actually, which is very good, because these people have the right to have the best from what they're getting, and what they're getting, they are supposed to know exactly what they are getting from the doctor. Whether it's a simple medicine or it's a stent, which is a very expensive device, which means life and death for the patient. So these are the things which are very important, and this is the evolving structure in Pakistan. Next please. What is happening to the doctor? Well, the doctor is becoming part of the growing competitiveness. I'm sorry, this is just a fictitious character. nothing to resemble anybody. But we today know that science, tradition, financial incentives, and personal biases, they are molding the thinking of the doctors. Again, the code of business conduct is very important. Those companies which are not relating or relying on the code of business conduct, they are the ones who actually cause a lot of problems for the doctors, because contrary to the interest of the patient, some drug may be prescribed which is not actually required by these guys. And another very important thing is that the evolving role of medicine and physicians. There is a very aggressive pharmaceutical marketing going on, which is not supposed to be done. And this is being said by one of the company's directors, who says that this should not be done. The aggressive pharmaceutical companies should be a bit careful. The reason for that is that we are promoting a lot of off-label indications which should be very carefully monitored. Again, something that we are not doing today, but which is a very common thing in the Western world. And a lot of companies actually are paying heavy penalties for just promoting the off-label indications. And we should be very careful about that also. Next, please. So, what is the impact of the information? It used to be a very simple primary care, secondary care, and tertiary care. Today, next slide please, with the advent of the information technology and knowledge, the individual care, family, friends and family, self-help, this is all going to be very important, playing a very important role. Professionals will be acting as facilitators, partners, and authorities. Next please. Cyber physicians is again becoming a problem. The doctors are actually, it's in a paradox condition. They are overloaded with information. They do not know exactly what is the right information and what is the made up information. So therefore, again, we have to be very careful. Next, please. So what should be our goals for the healthcare by the year 2015? 5 years from now, we will be looking towards more chronic disease management. This is going to become a cornerstone of the future healthcare industry. Pakistan is very unfortunate because we are still at the crossroad of having acute infections and also the chronic diseases in our country. And again, this is a very bad thing to have. The diagnosis would have to be made more rational. The patients and the public will come to the heart of the healthcare. Putting health at the center and not at the edge of the politics will become inevitable. Today, if you want to cut the budget, the most mesquite ministry is probably the health ministry, where the budget can be cut. That will not be the case after 5 years, because the health is going to become a very pivotal role in Pakistan very soon. And then again, from information, we would be moving towards the age of knowledge, and knowledge is going to play a critical role in the selection of everything that we do. Next, please. So, okay, so what is going to happen? I'll be very quick because I've run out of time. The pharma e-based role to the doctors is going to become very important. There is going to be e-detailing, e-diagnosis, e-prescription, e-records, e-follow-ups, and e-information. For those people who think that this is something which is this is a make-up thing, I think you do not know that majority of these things have already started to happen in the Western world. And the cyber physician is a reality in the Western world. Today in the Western world, the doctor can monitor his patient's heartbeat sitting 3,000 kilometers away. And that is all because of the chips that are being put into these patients. So we have to get ready for these sort of things in the net. And that is what is going to improve the quality loop as far as the pharmaceutical industry is concerned. Next, please. We need to have collaboration and partnerships. Disease awareness is very, very important, and we need to work very strongly with all the associated stakeholders. Preventive aspects have to be brought up, and of course, cost containment always remains in a country like Pakistan, and we have to make sure that there is cost containment. Next, please. Patient-centered approach is very important. As I said, at the end of the day, information, assistance, decision, and actions are what is required for the patient for the follow-up. My last slide, please. Next, please. So, people who are working in silos, the pharma, doctors, societies, and hospitals, they need to work together as one unit, as one team. We need to set up forums like the Health Asia that we have today. These forums where we can all work together, pool our resources, and make sure, can I have the next slide? Make sure that we can have a good working relationship. Drug Regulatory Authority could be a very good starting point in which all these stakeholders can work together and can bring about a change in the scenario of Pakistan, especially considering that in the next 5 years or 10 years, we are going to have a much bigger load on our economy. Next, please. So completing the quality loop, what should we be doing? Number one, clear ethical values. As Professor Murad said at the beginning of the conference, that ethical values are going to play a complete role in ensuring that quality prevails everywhere. Being clear about our mission, what are we supposed to do in the next 5 years? Putting the patients first, that should be our objective. Constantly trying to improve. Basing what we do on evidence only, not off-label promotions. This is something that we need to be very careful about. And then leadership in the industry and also learning should be at the core of every person's heart, whether it's a gentleman who's more than 65 years of age or a young person who's entering into the industry or who's coming as a healthcare professional. Learning is supposed to be at the heart and knowledge is supposed to be our basis. I thank you very much. My last slide. Thank you very much. And I finish by saying, as Goethe said, that knowing is not enough, we must apply. Willing is not enough, we must do. Thank you.